What is magnesium sulfate, Epsom salt? Hey, subscribe to the channel, click on the bell and listen carefully. Magnesium sulfate, commonly known as Epsom salt, is a mineral. It works by replacing magnesium in the body and increasing water in the intestines. Magnesium sulfate can be used orally as a laxative to relieve occasional constipation, and to treat low levels of magnesium, known as hypomagnesemia. Low magnesium levels can be caused by alcoholism, severe diarrhea, malnutrition, or high calcium levels, hypercalcemia. Symptoms include fatigue, muscle cramps or spasms, convulsions, and erratic eye movement, nystagmus. Some people use Epsom salts as a bath soak. It may help to relieve sore muscles, draw out splinters, and to ease the pain of sprains and bruises. The medicine can be used intravenously, through and to control seizures in pregnant women and certain children. It can also be used to treat a dangerous arrhythmia, lower high blood pressure, slow down contractions during labor, and treat other conditions as determined by your doctor. Magnesium sulfate can be purchased over the counter, OTC, or it can be administered in a clinic setting. Magnesium sulfate warnings: don't use a higher dose of magnesium sulfate than is recommended on the package or by your doctor. Taking too much of this mineral can cause serious, life-threatening side effects. Before taking magnesium sulfate, you should tell your doctor if you have kidney disease, heart disease, an irregular heartbeat, diabetes, a stomach or intestinal disorder, severe stomach pain, nausea or vomiting, a perforated bowel, a bowel obstruction, severe constipation, colitis, an eating disorder. Also, tell your doctor if you've experienced a sudden change in bowel habits, have been on a low magnesium diet, or have been using a laxative for longer than a week. You shouldn't take magnesium sulfate if you are pregnant and expect to deliver the baby within 2 hours. If you experience rectal bleeding or you don't produce a bowel movement after using magnesium sulfate as a laxative, call your doctor immediately. You may have a more serious condition. You should tell your doctor you are taking magnesium sulfate before having any type of surgery, including dental procedures. Also, alert your physician if you drink alcohol or caffeine, if you smoke, if you use street drugs, or if you are dehydrated before taking magnesium sulfate. Pregnancy and magnesium sulfate. Magnesium sulfate is a pregnancy category D drug, which means it could harm an unborn baby. You should tell your doctor if you are pregnant or plan to become pregnant before taking this mineral. Magnesium sulfate may cause low levels of calcium and bone problems in an unborn baby if taken for longer than 5 to 7 days during pregnancy. It's not known if magnesium sulfate passes into breast milk and harm a breastfeeding baby. You should talk to your doctor before breastfeeding while taking this medicine. Magnesium sulfate side effects. Common side effects of magnesium sulfate. You should tell your doctor if any of the following side effects become severe or don't go away. Diarrhea, upset stomach. Serious side effects of magnesium sulfate. You should tell your doctor right away if you experience any of the following serious side effects. Signs of an allergic reaction: rash, hives, itching, breathing difficulties, chest tightness, or swelling of the mouth, face, lips, or tongue, dizziness, flushing, or faintness, irregular heartbeat, muscle paralysis or muscle weakness, severe drowsiness, sweating. Magnesium sulfate interactions. You should tell your doctor about all prescription, non-prescription, illegal, recreational, herbal, nutritional, or dietary drugs you're taking while on magnesium sulfate, especially any type of antibiotic. Magnesium sulfate dosage. Oral magnesium sulfate. To take magnesium sulfate orally, dissolve 1 dose in 8 ounces of water. Stir and drink all of the mixture right away. If taken orally, magnesium sulfate should produce a bowel movement within 30 minutes to 6 hours. You should drink plenty of fluids while taking this mineral. Injectable magnesium sulfate. Injections of magnesium sulfate are typically given at your doctor's office, hospital, or other clinic. However, you may be given the medicine to inject at home. Follow the directions given to you by your healthcare provider. Don't use magnesium sulfate if it contains particles or is cloudy or discolored. Magnesium sulfate as a soak. You can also use magnesium sulfate as an Epsom salt soak. Dissolve into a large amount of water in a large bowl, bucket, foot tub, or bathtub. You should follow the directions on the product about how much magnesium sulfate to use per gallon of water. Before applying these recommendations, consult your doctor. Put a like under this video, subscribe to the channel, click on the bell and share this video.